Hello everyone, my name is Guerrero. I am a medicine student from Universidad Católica Santiago de Guayaquil. Today, under the subject of Medical English Group A, taught by Dr. John Moscoso, I will be having the pleasure to present to you my second research topic. Specifically, I will be presenting to you about acute methotrexate induced crystal nephropathy. We'll start by the definition. Methotrexate is an antineoplastic and immunosuppressive agent used as a chemotherapy agent to treat various types of cancer, such as lymphoma, leukemia, and solid tumors. Methotrexate can also be used to treat some autoimmune diseases, such as Crohn's disease, and most effectively can be used to treat rheumatoid arthritis. Methotrexate acts by interfering with RNA and DNA synthesis, thus slowing tumoral cell growth. High intravenous doses of methotrexate are related to acute renal failure in 2% of cases, and also a long-term therapy can be associated with kidney failure, progressive fibrosis, and cirrhosis. Kidney failure is when the kidneys are functioning at less than 15% of their normal capacity. Side effects. Some of the most common side effects a patient can experience are some of the following. First, we have headache, nausea, and dizziness. Second, we have mouth ulcers, and finally, hair loss. The solution to most of these problems is not to stop treatment, but rather to manage the dosage and use countering medication. Some of the tests that need to be run when using methotrexate are liver tests and full blood counts.
Low-dose methotrexate is extremely effective for treating rheumatoid arthritis and other conditions such as psoriasis. It remains the gold standard treatment within the professional healthcare community and has helped many patients feel better, control their disease, and achieve remission. Taken once a week, methotrexate works by reducing pain and swelling and can slow joint damage and disease progression over time. There is also evidence that methotrexate may reduce the burden of heart disease in rheumatoid arthritis. There are two ways to take methotrexate, either as a tablet or an injection. Tablets enter the bloodstream through the digestive system. However, injectable methotrexate avoids the stomach and intestines, which may reduce side effects like nausea and diarrhea in some patients. You might be aware that methotrexate is also used in some cancer treatments. It's the same drug, but the dosage levels used are very different. Most people are greatly helped by methotrexate and cope with few, if any, problems. But like all drugs, methotrexate can cause side effects, and your doctor or nurse will closely monitor you for these. One concern some patients have when prescribed methotrexate is hair thinning. Hair thinning is a possibility, but it's usually slight. Another common concern is feelings of sickness, especially when taking tablets. Fortunately, there are steps you can take to help minimize this. Studies show that taking a folic acid supplement reduces side effects by up to 79%, and changing from tablets to injectable methotrexate is also proven to reduce stomach problems whilst increasing the effectiveness of the drug. As to methotrexate and alcohol, a recent study has shown moderate alcohol consumption of less than 14 units a week shouldn't have an adverse effect on your liver. That means you can continue to enjoy the odd drink while on methotrexate. Just ensure your doctor continues to monitor your bloods regularly. It may take up to 12 weeks after reaching the best dose for your condition before you notice any benefits, so persistence is key. Remember, at any stage, you and your doctor can agree to adjust or swap treatments. A healthcare professional should always be your first port of call for information. There are also advice helplines, websites, and patient groups to help answer any questions you may have.
Applications in medicine. Crystal nephropathy occurs when some medications that are urine insoluble precipitate within the renal tubules. Crystal nephropathy is often an under-recognized pathology, and some of its characteristics include acute tubular injury. Intratubular and interstitial needle-shaped golden brown crystals can promote kidney failure, and also a creatinine increase.
Methotrexate is a very toxic drug. Has a huge black box warning at the beginning of the package insert that warns us about toxicities to the lungs, intestines, skin, soft tissues, bones, and especially the liver. These adverse effects are a big concern when using methotrexate to treat psoriasis and rheumatoid arthritis. That's because the patient is being exposed to the drug for a much longer time than those patients who are being treated with methotrexate for cancers. We also do not rescue patients who are receiving methotrexate for chronic diseases the way we do for cancers. So we need to monitor these patients very closely. The prescribing information says that we need to check AST and ALT in the blood along with liver function tests at least every month or two. While a rise in transaminases doesn't necessarily mean that we automatically have to stop methotrexate, seeing a rise in transaminases does mean that we have to monitor more closely and be ready to stop the drug if things suddenly get worse. In addition to causing acute toxicity to the liver, methotrexate also causes chronic fibrotic changes to the liver. Unfortunately, getting blood tests to watch for liver damage won't always warn us that the fibrotic changes are occurring. Life-threatening fibrotic liver changes can occur even if the liver tests remain normal. So, we need to find another way to see if liver fibrosis is occurring. We need to take a look at a piece of liver. When methotrexate is used long-term, for example, when it's used for psoriasis, it's recommended that the patient have a liver biopsy to monitor for long-term fibrotic damage. When they have this done is determined by how much total methotrexate they've received. It's usually recommended that the biopsy be done before starting methotrexate and after every cumulative gram to gram and a half. For example, let's suppose that someone's getting 25 milligrams per week of methotrexate for psoriasis. That's 100 milligrams a month. So after about 15 months of methotrexate, that person would have received 1,500 milligrams. At that point, another liver biopsy is performed. Then after every gram to gram and a half of methotrexate, they get another liver biopsy to check for fibrotic changes. Most often that would average out to be about once a year.
Pros and cons. Pros. Methotrexate has a 50% chance of improvement in rheumatoid arthritis patients. Acute kidney failure is usually reversible. And also, methotrexate is available in oral and intravenous formulations. Cons. It can take up to 3 to 6 weeks to feel effects, and 12 weeks to get full effects of methotrexate. Methotrexate can also cause pancytopenia, which is the low count of red blood cells, white blood cells, and platelets, and could also improve the risk of infection.
Hi, I'm Dr. Tom Palella, a rheumatologist with Rheumatic Disease Center Physicians. What can someone expect when they're started on methotrexate? They can expect to have a medication which they tolerate quite well, and over a period of time, they begin to notice an improvement in their stiffness, their pain, their fatigue. Their energy improves, the quality of life improves, their dependence on pain-relieving medications lessens, and they get back to a more active life. The medication has some side effects, most of which are mere nuisances and are easily managed by giving a vitamin called folic acid. The nuisance side effects include sores in the mouth, diarrhea, mild hair loss, abdominal pain, and sometimes nausea. There are, however, certain serious side effects that can occur as well. These include a severe form of asthma associated with fever or chronic progressive scarring of the lungs. Fortunately, these are quite rare, are easily recognized, and easily managed.
Issues applied in Ecuador. Chronic kidney disease is the fourth and fifth premature mortality cause in Ecuador. Mortality levels are between 6 to 7%. Methotrexate is widely available and used in Ecuador. Conclusion. While the use of methotrexate has proven to be effective in the use of chemotherapy and autoimmune diseases like rheumatoid arthritis, it should also be administered with caution, depending on the dosage requirements. Methotrexate has a lot of risk and adverse effects. When administered at higher dosages, can cause kidney failure. It's essential to follow and to not change the dosage prescribed by the professional. It has been a pleasure. Thank you all for your attention.